Hello everyone, welcome to my channel. Today's video is very important for every adult man and woman. Today we will talk about the main reason for not getting pregnant or the complete process of getting pregnant. In this video it will also be told what is the main reason for women to miscarriage. Do not skip any part of the video. Let's go to the main topic of the video. What is ectopic pregnancy? A fertilized egg typically adheres to the lining of your uterus. An ectopic pregnancy, also known as extrauterine pregnancy, is one in which the fertilized egg develops the outside of your uterus. Other places like a fallopian tube, the ovaries in your abdomen, or the lower portion of your cervix, which is above the vagina, may also fall under this category. Over 90% of the time, the eggs adhere to a fallopian tube. An example of this is a tubal pregnancy. Although rates are difficult to ascertain, one study shows that approximately 1 in 50 pregnancies in the US are ectopic. The fertilized egg has the potential to rupture as it matures, resulting in potentially fatal hemorrhage. If it does, you should seek immediate medical attention. It can be fatal if you do not get treatment. In actuality, ectopic pregnancies are the main reason for this trimester pregnancy-related deaths. Can a baby survive an ectopic pregnancy? No, it is crucial to understand that an ectopic pregnancy fertilized egg is not viable. This means that the egg cannot develop into a baby that can live inside or outside of your body. There will always be a miscarriage as a result. This is due to the egg's inability to receive blood supply and support necessary for growth outside of the uterus. Signs and symptoms of ectopic pregnancy. You might not initially exhibit any sign of an early ectopic pregnancy. They might resemble those of a typical pregnancy quite a bit. Missing your periods can cause tummy pain, breast tenderness, and missed periods. The three primary symptoms of an ectopic pregnancy are missed periods, vaginal bleeding, and abdominal pain are only present in around half of the women who experience them. Ectopic pregnancy early warning indicators include stomach pain, sharp abdominal cramps, weakness or dizziness, one side of your body pain, discomfort in the rectum, neck or shoulder. Your fallopian tube may rupture due to an ectopic pregnancy. Major pain along with or without serious bleeding or emergency symptoms. If you experience significant abdominal discomfort, especially on one side, and heavy vaginal bleeding along with dizziness, fainting or shoulder pain, call your doctor straight at once. When do ectopic pregnancies start? You might never understand the cause of your ectopic pregnancy. A damaged fallopian tube can be one of the causes. It might prevent the ovulated egg from entering your uterus. Having an ectopic pregnancy is more likely if you puff on a cigarette, over the age of 35, sexually contagious disease, have scares from a pelvic operation, previously had an ectopic pregnancy, attempted to reverse or undergo tubal ligation, using in vitro fertilization and other fertility treatments. Additionally, if you get pregnant while using an intrauterine device for birth control, it might occur. Ectopic pregnancy complications. The fertilized egg is enveloped in a framework that can develop for several weeks outside your uterus during an ectopic pregnancy. However, the structure often collapses after 6 to 16 weeks. An ectopic pregnancy that has ruptured can bleed profusely. Your body may begin to shut down due to blood loss. If the bleeding is not controlled, which increases your risk of dying, it almost never causes death if it is treated before it bursts. The fallopian tube to which it was linked may be harmed if the structure does burst. During the procedure, your surgeon could remove the fallopian tube. You do, however, have two fallopian tubes. You should still be able to become pregnant if your second fallopian tube is in good health. However, you can experience fertility programs if your other fallopian tube is injured or absent. In this situation, discuss alternative method of conception with your doctor, such as in vitro fertilization. Ectopic pregnancy diagnosis. Most likely, a pelvic exam or an pregnancy test will be performed by your doctor to examine your uterus and fallopian tubes. They could do an ultrasound on you. An ultrasound is a non-invasive test that employs sound waves to produce image of the uterus inside. A sonographer conducts the examination, which can be done transvaginally or transabdominally. A gestational sac, its position, and the presence of a fertile heartbeat are all things the doctor will check for during the ultrasound. ultrasound. The examination is painless and often lasts 15 to 20 minutes. A wand is used to an abdominal ultrasonography test which can be used to confirm pregnancy or look for internal bleeding. Ectopic pregnancy treatment. Your doctor will need to remove the fertilized egg because it cannot survive outside the uterus and could result in major health issues. One of two approaches, medications or surgery, will be used. Medication. Your doctor may administer an injection of methotrexate if your fallopian tube has not ruptured and your pregnancy is not fair along. The injection only has to be given once. It prevents the growth of the fertilized egg. In 4 to 6 weeks, your body will absorb the egg. The fallopian tube need not be removed in order to have this treatment. Your doctor will need to perform a few blood tests to check your levels of HCG before you can start taking methotrexate. Your body produces it when it recognizes a pregnancy. If you are nursing or have certain medical condition, you cannot take methotrexate. Following the injection, the physician will examine your HCG levels at subsequent consultation. You could require a second dose of the same medicine if your level do not decrease after the first dose. You must continue monitoring until no HCG is detected in your blood. You should be aware that taking methotrexate does not constitute a medical abortion, as you could experience if you are experiencing a viable pregnancy in which the fertilized egg has attached to the uterus. Mifepristone and misoprostol are two prescription medication required for a medical abortion. It is medically vital for you to take methotrexate before the egg bursts when you have an ectopic pregnancy. Your chances of dying or experiencing other severe problems may be reduced. Surgery. In some situations, surgery is required. Laparoscopy is the most popular. To remove the ectopic pregnancy, your doctor will make very tiny slits in your lower belly and insert a small flexible tube known as laparoscopy. Your fallopian tube might also need to remove if it is damaged. You might require emergency surgery with a wider cut if you are bleeding profusely or your doctor thinks your fallopian tube is ruptured. This is referred to as laparotomy. Side effects from surgery can include pain, bleeding, infections. You can experience fatigue and stomach discomfort for a few weeks after getting surgery or taking methotrexate. You might have symptoms of pregnancy for a while longer. You might not feel completely normal for a few period cycles. After an ectopic pregnancy, you can find it challenging to have a routine pregnancy following that. If you had a fallopian tube removed, especially think about speaking with a reproductive professional. Also ask your doctor how long you should wait before trying again in order to give your body time to recuperate. Some doctors advise giving yourself at least 3 months. Your chance of experience another ectopic pregnancy increase after one. Be aware of your body changes if you believe you are accepting again. Consult your doctor who can confirm it and take the appropriate action. The effect of an ectopic pregnancy can also be felt mentally. Do not be afraid to contact mentally health professional like a certified counselor or therapist. How to avoid an ectopic pregnancy. Ectopic pregnancy cannot be stopped, but by making certain lifestyle decisions you can reduce your chances. Do not use an vaginal dachi. According to study, taking a dachis can make an ectopic pregnancy more likely. Every time you have sex, use a condom. You can reduce your risk of developing sexually transmitted disease and pelvic inflammatory disease. With that, today's video comes to an end. If you have any question, you can message me on Instagram. If you want to know more about preeclampsia or condition that occur during pregnancy,